This is Mrs. Terry, and this is continuing Pharmacology, Unit 6. And we're going to try to get 11 and 12 done in this lecture. But I want to go back to Chapter 10, just some highlights that I didn't cover. The first is make sure you know the key terms, the pathophysiology of TB. Make sure you understand that TB is very slow growing. People oftentimes don't know they have it. It may take years for the symptoms to develop. And once the initial stage has passed and it becomes progressive, you can spread it to others, of course. It's diagnosed by chest x-ray and a blood test and a sputum culture. So make sure you read all this information on TB. Very important information. The one drug I want to talk about, anti-tubercular drugs, is rifampin. And make sure you know the side effects, adverse effects, what category of drugs it is, what to do before and after giving, especially rifampin. And it is the one, you remember, that can stain the urine and skin, that sort of thing. Fungal infections, make sure you understand the difference between a fungal infection and the other types of infections. If you're given a topical antifungal agent, that's listed on box 10.1. You need to read about that, how to give topical. You need to know the common drug categories and the dosages. Well, not the dosages, but the categories. Redmond syndrome, we talked about that. Amphotericin B, the side effects, that's on page 167. Know all those drug alerts and administration alerts. Make sure your patients aren't taking grapefruit juice. That's common with everything we've been studying. And read about antifungal drugs and pediatric considerations. You know, they take it for ringworm and of the scalp, and it can have a lot of side effects also. So you need to read about that. And read the key points in Chapter 10. And it talks about grapefruit juice down there. Okay, drugs that affect the immune system. True immunity is the ability of the body to recognize specific organisms when it reinvades or re-exposes itself to the body's internal environment, and to take steps to remove, inactivate, or destroy the invading organisms. So the body recognizes a specific organism as being foreign, and it wants to destroy the invading organism before we get sick. The main tissues of the immune system are the white blood cells, the leukocytes, the substances these cells produce in tissues containing colonies of white blood cells, such as lymph nodes, tonsils, intestinal tract, and the spleen. All of that is where we have colonies of white blood cells. And their main function, one of the main functions, is to protect us via the immune system. The bone marrow is the original source of WBCs, and that's why people who have leukemia, etc., have to have bone marrow transfusions because they are not producing white blood cells. Immunity. Lymphocytes, I told you, provide the long-lasting true immunity. Acquired immunity is an adaptive or learned internal protection that results in long-term resistance to the effects of invading microorganisms. So once we've had a disease, we acquire immunity to it, and it protects us long-term. Antibody production is the adaptive process performed by B cells after they learn to recognize a specific invader. All white blood cells can recognize an invader, and white blood cells involved in inflammation are best at it. So the B cells learn to recognize specific invaders. Any cell, product, or protein with a code different from our own tissue type that enters the body and is recognized by your immune system as foreign is called an antigen. So antigen is foreign. Antibodies is what is good. If we develop antibodies, such as this COVID virus, then we're protected. So understand the difference in antigen and antibodies. An antibody is a wide-shaped protein with areas on its arms that bind directly and tightly to anything that has the same specific code that triggered the B cell to make the antibody. Each B cell learns to make only one specific type of antibody that can only recognize and bind to one specific antigen. So that B cell makes one type of antibody that recognizes and binds to the antigen. And again, that is why I love nursing. I find it absolutely fascinating what the body can do in something as small as one B cell. If you think about it, it's absolutely amazing. When you are invaded by so many viruses and you get sick, many fresh, unsynthesized B cells in your body start learning to make antibodies, so anti-chicken pox. If you get the chicken pox, then these B cells start learning to make anti-chicken pox antibodies. So naturally acquired immunity refers to how the exposure to an invader occurs. This type of immunity can be active immunity, where your body develops its own antibodies because you have had the disease. Naturally acquired active immunity starts when you are invaded by a foreign organism without assistance, and your B cells then learn to make antibodies. That's the strongest and most lasting immunity, is naturally acquired immunity. It is passed from a mother through the placenta and through breast milk. Artificially acquired, this type of immunity is used to assist the body to learn to make without you being sick. So anti-diphtheria antibodies, we're hoping anti-COVID antibodies. This immunity is started when an antigen is deliberately placed into your body to force your B cells to make a specific antibody against it. This type of immunity is commonly developed in most countries with the widespread use of a vaccination. So we did that with mumps, measles, rubella, all of that. We got artificially acquired active immunity if we hadn't already had the disease. You need to know what a vaccine is, what immunization is, the types of vaccines: inactivated vaccines, attenuated vaccines, toxoids, and biosynthetic vaccines. Inactivated contain the organisms that could cause the disease that have been killed or inactivated by heat, radiation, or chemicals that prevent the organisms from reproducing, such as the flu vaccine. You're given the actual organism, but it's been killed. Attenuated means it contains a live organism that has been modified so that they're no longer capable of reproducing the disease. Live viruses are mumps, measles, rubella, polio, and chickenpox. That's an attenuated vaccine. Toxoids contain either a modified toxin that an organism produces or the actual part of the organism, such as tetanus, diphtheria, pertussis, HPV, and HDV. Biosynthetic vaccines, science-made substances that are similar to parts of a virus or bacteria that cause a disease. So influenza type B. So be sure you know these types of vaccines. Artificially acquired immunity is the type of antibody-mediated immunity you would have if antibodies made by another person were injected into your body. Because these are foreign to you, your immune system recognizes them as foreign and eliminates them quickly. For this reason, passive immunity provides only immediate short-term protection against a specific antigen. The injection antibodies are expected to inactivate the invading organisms, and that is like tetanus. So you immediately get a tetanus shot if you have cut yourself and you need something fast that will recognize that tetanus as foreign and eliminates it quickly. Rogam is another. Immunosuppressive therapy, the immune system can overreact and cause damage to our bodies. So our immune system can overact. Some problems are acute and short, like an allergic reaction. Other problems, like autoimmune disorders, can be destructive. Organ transplants need immunosuppressive therapy for the rest of their life. Organ transplant patients to prevent rejection of the new organ. Autoimmune disease is a condition in which a person's immune system sees some of his or own cells as foreign and develops an immunity. So if you develop an autoimmune disease, your body attacks its own well body. Transplantation immunology, newer anti-rejection drugs are now being used to help these transplant patients. Corticosteroids is an immunosuppressant drug. DMARDs, we talked about that when we talked about arthritis. Cytotoxic drugs purposely destroy the cells, like chemotherapy, and the selective immunosuppressants. And those can be anti-proliferatives, calcineurin inhibitors, monoclonal antibodies, and polyclonal antibodies, and how they work. Let me look at that chapter. You need to know the overview of the immune system. You need to understand antigen and antibody, T cells, B cells. Read that on page 175. B cell recognition of antigens is the trigger for B cells to begin making antibodies. You need to understand active immunity, naturally acquired active immunity, natural acquired passive immunity. Make sure you understand that. Artificially acquired active immunity is when an antigen is deliberately placed in your body to force your B cells to make specific antibodies against it. This type of immunity is commonly developed and used for vaccinations. A type of vaccinations: inactivated vaccines, attenuated vaccines, toxoids, and biosynthetic vaccines. You need to know the 4 types of vaccines and how they work. Responsibilities for administering vaccines. You need to document in the record when you give a vaccine. You'll see them write the name of the patient, the name of the vaccine, the manufacturer, the lot number, the expiration date, how much you gave, where you gave it, and the condition. And you'll notice that when, especially like if you see a TB skin test, they'll write down right forearm, left forearm, what the site looked like, etc. You need to know how to document if you give a vaccine.
Your mother needs you.
Moving along, Chapter 12 is anti-cancer drugs. There's quite a few key terms in there you need to be familiar with, especially carcinogenic, cytotoxic, extravasation, vesicants, targeted therapy, alkylating agents. Okay, Chapter 12. Cancer is an abnormal cell growth. We know that it serves no useful purpose and would lead to death without intervention. Cancer cells were at one time normal cells, and they've undergone genetic changes that result in loss of control over cell division. Metastasize. These cells have poor growth control and do not respect tissue borders. They overgrow and spread to other areas in the body. So they have an initial site and then they metastasize. They'll go to the liver or to the brain or wherever. The multi-step process of changing a normal cell into a cancer cell is called malignant transformation or carcinogenesis. Carcinogens, you know what those are. Those are substances or events that can damage a normal cell's genes and cause cancer development. They can be chemicals, physical agents, or viruses. The original site of the cancer is called the primary tumor. And then when they move elsewhere, as we talked about, they are called metastatic or a secondary tumor. Types of treatment: chemotherapy. Chemotherapy drugs, all chemo drugs are high alert drugs because you can kill someone. Too high or too low, you can hurt them. If given to a patient who doesn't need it, goodness me, we don't want to think about that. Or not to a patient for whom it was prescribed. There are 6 categories: antimetabolites, anti-tumor antibiotics, antimyotics, alkylating agents, topomerase inhibitors, and miscellaneous. Those are listed in your book. On page 196, table 12.2, chemotherapy drug categories, and some of the, I don't know if you'd call them common, but some of the names of the drugs that you might hear of. I'm trying to look to see if there's any particular ones. So, of course, chemotherapy is the treatment of choice. And antimetabolites, you need to know this right here. Antimetabolites act like counterfeit metabolites that fool cancer cells, so into using the antimetabolite in cellular reactions instead of the real metabolite. Their presence impairs cell division. Antimetabolites. Anti-tumor antibiotics damage the DNA of the cell and interrupt the DNA RNA synthesis. And you hear that a lot nowadays in breast cancers. They type it to see if it's a hormone type breast cancer, and see if what the DNA RNA is. Antibiotic agents interfere with the formation of tubules, so cells cannot separate during cell division. Antibiotic agents, they interfere with the formation of the tubules, so the cells cannot separate during cell division. So they stop it at the level of the cell division. Alkylating agents cross the linked DNA, making the 2 DNA strands bind tightly together, inhibiting, again, cell division. Topomerase inhibitors disrupt an enzyme needed for DNA. So see, almost all of these are working on the DNA of the cell to stop their action. Miscellaneous are those whose actions are unknown, so a lot of treatments. Make sure you know how these drugs work. Drugs are given on a regular basis and time to maximize the number of cells killed, as well as minimize the damage to normal cells, because they also damage normal cells. Often scheduled, dose-dense chemo or higher doses more often with intense side effects. Most of them are given IV. Extravasation, drug leaks into the cells, and that is big time complication. Cause blood clots, all kinds of, can necrose your skin, horrible. These drugs are vesicants. They cause tissue damage on direct contact, so you cannot touch. If you have a chemo spill, all entities have a protocol for chemotherapy medicine spill. You do not touch it. You have to follow the protocol of your agency. Hormone manipulation, this is what I was talking about for breast cancer. Prostate cancer is hormone sensitive, and aromatics prevents the production of estrogen in the adrenal gland and reduces blood estrogen levels. So breast cancer cells that need estrogen to grow, it limits the amount of estrogen present. And estrogen also binds to testosterone receptors, preventing the patient's testosterone from binding to the cancer site. So hormone manipulation is getting very well used. Targeted therapy agents used as targeted therapies work to disrupt cancer cells by targeting and blocking their growth. TKIs and epithelial growth factors, etc., are some of those targeted therapy. Immunotherapy, biological response modifiers stimulate the immune system to recognize cancer cells and take action. So trying to kick in our immune system to respond. Two commons are interleukins, which you hear of, and interferons. So they're interfering with these cancer cells to try to eliminate or destroy them. These patients have generalized and severe inflammatory reactions, fluid shifts, capillary leak with edema forming in most tissues. This can be life-threatening. Patients receiving interferon have peripheral neuropathy. So we're hurting our patients at the same time that we're trying to help them, and but it is needed. So you need to understand dose-dense chemotherapy. Higher doses are more often called dose-dense. You need to understand that. You need to know antibiotic agents and what they do. You need to understand the word vesicants, what it does. Hormone manipulation, we talked about that. Targeted therapy, talked about that. And read the key points at the end of that chapter where I went over that really fast, but I'll try to send you some more information as I can. I hope these videos have helped you. Thank you.